why would I be sitting here?
No, I agree. I mean, I think the fact that you're here means that sort of, I guess, there's a way you're hoping for or wanting for something. But I think
Well, there's two reasons why I'm sitting here. One, because I'm more in need of help now than I ever was before coming into contact with your service. And two, I also feel like I want some closure on what people about how people have come to give me the diagnosis they've given me.
Sorry, say again. The first one was what about our service? The first reason.
Sorry?
You said the first reason was something to do with because you're in our service now, and the second reason, is that right? And then the second reason is to try and get some resolution for this diagnosis.
Yeah.
So because you're in our service, you're hopeful that we could provide something that could be helpful for you.
This is a bit tiresome. Really tiresome.
What's the frustration?
I'm a bit sick of saying the same thing over and over. I've said it to you about 3 or 4 times now, and you avoid it.
What did you avoid?
You avoid giving me an answer as to why I've been given the diagnosis that I've been given, what it actually means, and what the diagnosis is and how I'm viewed.
What strikes me is that we're coming back to that issue again. We can talk about it a bit more if you
Yeah,
like.
because it's an important issue, and it's a question that I keep asking your service, and I've asked them over a number of years. I mean, if you don't want to explain diagnosis to people, why dish them out? Why give people diagnosis that you're not prepared to sit down and talk to somebody about that diagnosis, how it's come about and what it actually means? Why give people diagnosis?
Well, you're talking to me now as if I've given you this diagnosis,
No.
which I haven't.
Okay, that's what I said by sloping shoulders. Your shoulders have gone like that, like a Guinness bottle. I've just asked you a question and it's just slipped straight off them shoulders. It's not your responsibility, it's not down to you, it's somebody else did it, blah blah blah, etc etc etc. I've heard that before. It's really, that's why I said this is tiresome. This is very tiresome. I've gone through this process with a varying amount of people over the last few years and got the same flipping result.
Well, I'm kind of happy to kind of think with you about some of these issues, but I can't answer for completely.
No, nobody ever can.
Gives you this diagnosis.
Yeah, nobody can. Dr. Stern couldn't either. Maybe I should just bash my head on the wall.
How would that help?
I don't know. How is this helping?
I guess what kind of was one thing from today I was hoping to kind of think with you about is, a focus for what some kind of sessions of therapy could help with. But it feels to me that sort of actually when we get into some more kind of personal or painful areas that you feel very sort of cautious about.
I'm sick of talking about myself. I'm sick of talking about myself. I'm sick of opening up to people and telling them things about me, personal things to me, things that I find difficult to deal with, when people can't answer a fucking straight question that I ask them.
So what, it brings a kind of worry about whether you can trust me enough to kind of talk about something?
When I walked into this room, you had my absolute trust. Absolute trust when I walked into this room, and it's just going down. So,
well, I think my sense of you and how you came to the room is that you find at the moment that it's very, very difficult to kind of trust anybody, and that whatever the things are,
really?
they are more kind of.
It's my issue, right? It's all this is about my issues. This is about me having an issue of trust. I don't trust people, so therefore blah blah blah. This is my problem. It all seems to be my problem. I actually think your service has made massive fucking mistakes. I think I think the way that you've dealt with me is absolutely appalling and shocking. I've actually had that confirmed by somebody that they have made mistakes, but when it actually comes down to getting redress for those mistakes, nobody wants to address it. I don't know I don't know what people are frightened of. No idea. And to be quite honest, I'm getting a bit of a problem with psychiatry and psychology, to be quite frank. You seem to have this tiny little mouse view of what reality and what is normal is. And it's not really one that I fucking recognise. I'm just getting sick of a lot of you, really, to be quite honest. I'm fucking nearly done with this. Nearly done with this bullshit.
Feels to me that there are things which are going on in your life that you are struggling with, which you touch.
I'm not entirely sure that you have any feelings whatsoever.
But it feels difficult to kind of stay with those because it actually feels very kind of unsettling and very unsafe for you to talk about those things with somebody else. And actually what ends up happening is you get into a familiar position of feeling feeling angry.
Yeah, I hear you saying that I end up in a familiar position. The reason I end up in that familiar position is because I keep asking the same fucking questions and I don't get an answer. I've said it again. I don't know how many times I've said it now. 5, 6, 7, 8, 9, 10. You know what I'm saying to you. So why don't you just address it? Either address that or tell me that you cannot address it.
You'd like me to address the question of why you've got a diagnosis of psychopathy, which you haven't.
I didn't say that. I did not say that I had a diagnosis of psychopathy.
Okay.
I said it would appear that the diagnosis I've been given is viewed as psychopathy.
Okay.
Right?
So
that's what I said.
So what's the answer
right? Now,
if
you
to then?
Sorry.
What's the question that you want the answer to coming here today? So that it needs to answer your question directly. So.
Have you not heard it? I thought your job was to listen. Isn't that what you do? You're very good at listening, right? Is that right? Are you good at listening?
Struck by kind of an increase in kind of anger and attack from you in this conversation.
Yeah, because I'm sick of saying the same thing over and over and over and nobody wanting to deal with it. And you're exactly the same. You're exactly the same. I've no idea what it is that you feel like you're protecting or that you can't do or that you can't say. Do you have to hide? Do you have to do you feel safe behind your professional boundaries? This big wall that you put up to protect yourself? Does it feel all right there? That you can see and you accept it almost. That you could understand why, when I was given diagnoses in the way that I was given, that would make me suffer. So I'm asking people, and I keep asking people, to do something and say something and give me some information, give me some help that will ease that fucking suffering. And they keep saying, oh, it's not me, it's somebody else did that, I can't say anything, blah, 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 blah. Let's go back to this, let's talk about this and take it off subject.
My sort of understanding of where we started today was of talking a bit about your experience.
You just did it again. You just did it again.
Did what?
You just did it again.
There's something, it sort of, something about this process becomes very, very difficult for you. I'm trying to sort of help kind of make sense of what it is that you've got kind of very, very upset by with this diagnosis.
No, I think you're trying to stay in control of this conversation. I think you're trying to direct and control this conversation. And I'm sitting here asking you really what seems to be, to me, quite a simple question. That I would like some time to discuss it. I would like to go over it a bit with somebody that's prepared to discuss it and go over it and explain some things to me.
Would it help?
And you're not doing that, and you keep wanting to take it off that question. Now, if you want to do something that frustrates somebody, keep fucking ignoring what they're saying.
Would it help if we got some of these diagnoses out and had a look at them on paper and we can talk through some of them?
I know what it says on paper. That's exactly what Dr. Stern did in our last session.
Oh, okay. Right.
Pointless.
So, I'm not quite sure how you kind of could see how anything could sort of really help. I mean, if he's already gone through these...
Well, he didn't really.
He did? Or
No, he didn't. We didn't even reach down the bottom of the list. He got a bit stuck on schizoid personality disorder. schizotypal and was going, oh, you haven't been given that one yet, have you? You haven't been given that one.
Was that?
You've been given all the others though, haven't you? You're in every other cluster, but you're not in that cluster, are you?
Well, I guess the sort of problem is this, really, that you've been given this diagnosis by Unity House. My understanding is that sessions there have not felt helpful to you, so you've stopped going to that service. You're left over with a question about a diagnosis which they've been given to you. I can't speak for them in terms of how they came to that diagnosis, and I don't know you because it's the first time we've met, so I'm not in a position to give a diagnosis of you because I don't know you. But I can, if we can find a way to work through this together in a way that would be helpful, I'd be very happy to offer you some
You don't know me.
sessions.
You don't know me.
We could, with one thing.
You don't know me.
1 second, please. Let me finish.
You don't know me. Is that what you just said?
No, please let me
No, I just want to know that I heard you
finish.
correctly. I just want to know that I heard you correctly. You just said, yeah, I just want to know that I heard this correctly. You just said, you don't know me.
This is the first time that we've met today. So I can't speak for why these diagnoses have been reached by other people. But what I can do is we can take some time here, we can take some sessions here to have a look at this and have a think about it and do what we can in this space to work through some of what's left you feeling deeply, deeply hurt. And
I don't think that's going to happen, I'll be honest with you.
Well, the offer is there if it's something that you'd like to take up.
No, because we keep playing this stupid game, really.
Well, what we're trying to do today is trying to find a focus for what's going to feel helpful to you in the sessions. I mean, I'd be happy